A lab sleep test is an extensive, very detailed recording of what happens to your body and your brain while you're sleeping. That involves going to a dedicated facility that is generally called either a sleep lab or a sleep center, and sometimes mistakenly called a sleep clinic. So you go there. Typically, these facilities are separate from hospitals. These are freestanding facilities. And there are typically a number of rooms that look like an average bedroom, and these do not look like a hospital room typically. There's equipment, which means that they attach a number of electrodes and wires to your head, to your chest, and your legs, and a sensor usually to your nose. And all you need to do is go to sleep in that bed and just be comfortable with being in a new environment that obviously is not your home and not your own bed. So this, after a whole night of recording, what we find out is a lot of information about when you actually went to sleep, how long you slept, how many times you woke up during the night, and how you were breathing, what was happening to your body movements. Did you actually suddenly wake up or start talking or try to get out of bed? There are a lot of different sleep problems that show up and can be well explained by looking at these test results. When I, as a physician, look at the test to give you the results, then I get to see a video of what was actually happening to you during the night, as well as a detailed recording from those electrodes that consist of brain activity, breathing activity, chest movements, leg movements, and so on. So that is a very useful diagnostic test. Oftentimes, there are different kinds of these tests also. There is, as I described, an all-night test, and then there is one that's called a split-night study. A split-night study is when, in the first part of the night, you are tested primarily for having trouble breathing. And if a certain level of breathing is observed in the first part of the night, then the technician who is there will introduce you to a CPAP machine, put on a mask on your face, and try to find out if a certain amount of air pressure delivered through the CPAP machine will correct that breathing problem. And then thirdly, a third kind of test would be when you go in and sleep there at the sleep test, at the sleep lab, and from the very beginning, they will put a mask on your face and try out different pressures of the machine to spend the entire night in trying to figure out what is the best way of correcting the breathing problem that you're experiencing. Yet another kind of sleep test is done during the daytime hours, and that has a longer name. It's called a multiple sleep latency test. On that test, what we are trying to do is to figure out if you are excessively sleepy during the day related to some medical problems. So how that is done has very specific requirements. That daytime test typically follows an overnight test all night. And then during the day, you go through a series of 20-minute naps, and you're allowed to fall asleep during those naps to see how quickly you fall asleep, and your brain activity is monitored during that time.